Warm welcome to the latest DiabetoShorts podcast, brought to you by MedSynapse. DiabetoShorts covers a wide range of clinical and scientific medical content that offers enriching insights into the world of diabetology. In today's podcast episode, we will discuss details of an observational case control study titled Cardiovascular and Renal Outcomes with Efpeglenatide in Type 2 Diabetes, featured in the September 2021 issue of the New England of Medicine. It's been observed that patients with type 2 diabetes mellitus have a considerably higher risk of cardiovascular morbidity and mortality. Several factors contribute to the higher risk of cardiovascular diseases in these diabetic patients. Hormones like 4-glucagon-like peptide 1, GLP-1, receptor agonists, that are structurally similar to human GLP-1, have been shown to reduce the risk of adverse cardiovascular events among people with type 2 diabetes. The stimulatory action of GLP-1 on insulin secretion involves interaction with many signal transduction processes including ion channel activity, intracellular Ca2 plus handling and exocytosis of the insulin-containing granules. Efpeglenatide is associated with a reduction in major adverse cardiovascular events, death, myocardial infarction, or stroke, and a reduction in composite renal events. In this randomized trial, which was based on the use of sodium-glucose cotransporter 2 inhibitors, effect of efpeglenatide in 4,076 participants with type 2 diabetes was evaluated. Patients with either a history of cardiovascular disease or current kidney disease plus at least one other cardiovascular risk factor were included in the study. The primary outcome was the first major adverse cardiovascular event, which includes a combination of any of the diseases like non-fatal myocardial infarction, non-fatal stroke, or death from cardiovascular or undetermined causes. The patients were given a dose of 4 or 6 mg of efpeglenatide or a placebo. Out of 4,076 patients, 2,717 were assigned to receive efpeglenatide and 1,359 to receive placebo. It was observed that out of all the cardiovascular events, a composite renal outcome event, a decrease in kidney function or macroalbuminuria, occurred in 353 participants, 13.0%, assigned to receive efpeglenatide, and in 250 participants, 18.4%, assigned to receive placebo. Then, other events like incident major adverse cardiovascular event occurred in 189 participants, 7.0%, assigned to receive efpeglenatide, and 125 participants, 9.2%, assigned to receive placebo. Based on the above findings, we can conclude that patients who received weekly subcutaneous injections of efpeglenatide at a dose of 4 or 6 mg had lower chances of witnessing cardiovascular events, although several effects like diarrhea, constipation, nausea, vomiting, or bloating occurred more frequently in patients receiving efpeglenatide than with placebo. This concludes our today's DiabetoShorts podcast, brought to you by MedSynapse. Thank you for listening.